So let's have Tim tell us a little bit about himself.
Oh, thank you. You put me on the spot. So I'm a registered nurse. I've been a registered nurse for 32 years. And, I've had a lot of experiences in health system and health system leadership and had the opportunity to move into the role as CEO of CNA after I finished my term as president. And now I get to do policy work, and it's so much fun just to be the co-host of ICN and just meet and network with nurses from all over the world and learn. It's just been awesome.
Yeah, and I think that it goes without saying that the CNA has put a tremendous amount of work into this conference, co-hosting it here in Montreal. What other great work is the CNA doing right now?
Well, for the last little while, our focus has really been on advocating for health human resources and responding to the significant crisis we have with respect to nursing, but not only vacancies and the shortage of nursing, but dealing with the significant workplace and work culture and workforce issues that I think are driving nurses out of the profession, and actively advocating to government to really respond and focus on retention. We've also been doing our part as a member of the international community to try and encourage governments to focus their efforts on retaining the workforce we have, putting in place mechanisms that improve the work environment for nurses, and not be as focused on active international recruitment. Canada is unfortunately one of the top countries in the world right now that are actively recruiting internationally, and it's put a bit of a black mark on our reputation, and so I think we've been doing our part there too.
I mean, I think that all of these conversations are hugely important in terms of the work that's happening with the CNA, the work, and I always think about the work that we can do at the ground level, frontline nurses that are working in various different non-traditional roles, and just that whole piece of advocacy. So maybe you could tell our listeners, some new nurses that are nursing students, how we can play an active role. Because I think when people think about policy, they're like, oh no, policy, but it's like policy is actually really, really important. And we think about policy in terms of the changes that we want to see. So how can we be a part of the solution?
There's lots of ways. I think this is one of the things that we as nurses don't realize the power and influence that we have. We're 460,000 strong across the country. And if we all participated collectively on an issue, the impact we could have is immense. When you think that there's probably a nurse there is a nurse in every riding in this country. The influence we could have on elected officials. And you can participate, and CNA does some of our advocacy campaigns with mail-outs. Nurses have told us they don't feel comfortable sometimes writing a letter to their MP, but they'll put their name to one if we can help them with a template. And so we're providing some of those things. So participating in that. Voting. Yes. Just voting, right? Running. Nurses that run for office, they can make a huge impact on policy. And even at the local level, just working on, if you identify a policy in your workplace that's outdated, that doesn't meet the evidence, even bringing it forward to the people that can make a decision to fix it is advocacy.
Yeah, I think there's so many different ways that nurses can advocate, and just thinking a little bit outside the box and looking towards role models like yourself who have done a great job. And we're all still here. We all survived. I think it's just about taking small steps and building that skill over time. That's the part where we have to get a little bit out of our comfort zone and do something a little bit different. Maybe you could also tell us, Tim, about what you hope to get out of this conference.
Well, and I think there's so many amazing topics. And so I think it's trying to get out and see what is happening around the world. What's happening that we might actually be able to bring home or keep at home that we can impact. I think one of the things that I'm hoping is that we'll see some more examples of nurse-led, nurse-driven, nurse-provided services that could impact the access to healthcare for Canadians. I think we need to do different things. We need new models of care. We need to stop doing things the old way. And what a better way to learn some of those things by individuals that are doing it. Yeah. And
I think that is the takeaway, right? That there's so much work that we can do, and I really believe that nurse-led clinics, nurse-led initiatives will be the way of the future. We can't keep doing what we've been doing. It's not working. It's time to do something different and time to see change. So thank you so much, Tim, for coming on our little impromptu session, and hope to see you for the rest of the time.
Yeah, you too. Thanks so much for coming.
Thank you.